Welcome to Prime Women Media's Reignite Libido, Find Out the Secret to Amazing Intimacy webinar. Hi, I'm Dorothy Shore. I am CEO and co-founder of Prime Women Media. Today we have with us Dr. Karen Leggett, and you are in for a treat. She is triple board certified. She takes you all the way from family medicine through geriatrics and regenerative medicine. She's also the founder and CEO of Women's Midlife Specialists. She told me earlier that she loves women in their middle age. So don't we all. The Personal Wellness Medicine and Leggett Medical Group. She is also the creator of the Happy Hoo Hoo for vaginal health and of Young Hormones, a luxurious line of natural bioidentical hormone creams available over the counter. Please join me in welcoming Dr. Karen Leggett.
Yay, thank you so much, Dorothy. That was such a beautiful introduction, and thank you so much for having me. What an honor to be here with Prime Women. It's just amazing. I love what you have done. I love what you say about Prime is for the ageless generation of women, and boy, that is us. But yes, I'm excited. And so the first thing I think I'll share with you a little slide presentation that I put together. And let's get started on reigniting libido and finding out the secret to amazing intimacy. We're going to have a lot of fun because intimacy and our libido is extremely complicated. It's not like guys. We are a little bit more complicated than they are. And in fact, we have 4 general causes of low libido. They can be emotional causes, psychological, environmental, and physical causes. So they're all interrelated too. And it's usually not just one thing, it's usually more than one. But I'm going to give you a little snippet of each of these 4 causes so you can think about where you are and what you personally can work more on. Okay, let's start with emotional causes. So emotional causes, they occur when we don't feel connected with our partner. Sex can be boring or unexciting, or we just simply feel disinterested. And it's extremely common, and it is absolutely not your fault because it stems mostly from a lack of communication, a very specific kind of communication. Love communication. And love communication is something that you feel versus something that you know. For instance, we know our partner loves us, but we want to feel loved. And that's what love communication is all about. So I've put a few questions together that will help you think about your love communication. Do you know what you need in order to feel most loved? Do you know what your partner needs so he feels most loved? Are your needs the same as your partner's? And if not, do you know how to communicate and provide your partner with what they need? And do they know how to provide you with what you need? So this is really neat because I've put the websites on here where you can take a little quiz. These quizzes only take about 5 to 10 minutes each. And it's the one activity that you can use right now to change your love life. And I'm not kidding. The first one you may have heard about is called the 5 Love Languages. And it was written, it's a best-selling book, but it was written by Gary Chapman. And he now has written a whole string of books on the same subject. And there's the website for it right here. And then after the 5 Love Languages came out and became so well known, Truity, which is a company that puts together a lot of personality tests and quizzes for people personally, but also very much for businesses, they analyzed the 5 love languages very closely and came up with their own version, and they call it the 7 love languages. And it's fascinating. Both of these, I highly encourage you take both of these quizzes. So let's have a little fun now. I want to give you a real example of what this is so you understand how valuable this is. So here's me and my husband David's love language. We've been married 41 years, and we only knew each other for 2 weeks when we got married. So there was no way that I knew his love language, right? So here's me on the left, on this side, and here's David. So this is the 5 and this is the 7. And my number one thing, and I didn't know it before I did this, 33%, my number one is acts of service. And my goodness, I am absolutely, totally in tune with that, because yes, I really get excited when he does little things for me or big things for me. That's what means a lot to me. And then I was so interesting to find out that his was quality time. So the number one thing to him was quality time, whereas look at me way down here at quality time. So this taught me very quickly that, wow, I know what he needs and I know how to communicate that to him by giving him my quality time. Now, the 7 love language is very interesting because they use different types of categories: emotional, intellectual, practical, and so forth. And you can see mine, number 1, is emotional, which is no surprise to me because I really like him to listen to me and understand my emotions. And he doesn't need me to do that at all, pretty much at all. For him, it's very low on the list. But and then my second is intellectual, which is no surprise to me because I really need a smart man. And look at that. His number 1 is intellectual and his number 2 is appreciation. So these teach you and help you understand how to communicate your love language. And when you both do it, you're set in understanding how to give to the other. So let's move on to psychological causes. And this can be a little tougher to work with because this is about the thoughts and feelings towards your partner and the thoughts and feelings towards yourself. So for instance, trust versus distrust, respect versus disrespect, forgive and forgetting, being able to forgive and forget. And when it comes to yourself, a lot has to do with our history, our background, what we've been through. So our self-image and our self-criticism is very important. So when we're talking about distrust and disrespect, this can be hard to overcome. So I want to help you right now kind of hone in on that if this is going on with you. And it may not be, but this is a very complicated subject. And this is a big part. So you want to start, if let's say you're feeling a little disrespect or a little distrust, you want to first start with deciding, is that distrust or disrespect actually warranted? And how you can determine that is by saying to yourself, well, am I distrusting or disrespecting him for something that was way in the past? Or is this something that is currently going on in the present? So that's the first thing that you have to ask. And if it's something in the past, I'm going to talk about that in just a second, then I have a solution for you. If it's something that is current, then the next step is that you need to determine who needs to do the work to fix things. Do you need to do the work by yourself? Does your partner need to do the work or make changes? Or do you both need to? So let's delve into this just a little more, because this is super helpful in other areas of your life as well. So let's say, what are some examples that require just your partner to change? That might be something, a bad habit that he currently has, like active alcoholism, or just unemployed and not trying to improve the situation, or some kind of negative habit that affects you or your family. That's something that he has to change, not you. Then causes that are you yourself can put into action would be the same thing, but he's doing something about it, like he's unemployed, and that can cause some disrespect, right? I mean, we're human. He's unemployed, but he's making efforts to get another job, or he's actually retraining for another job, or he's making efforts to cut back on his alcohol or whatever it is, whatever that unhealthy habit is. That is you. That is something that you can overcome by yourself. And I'm going to show you how in just a moment. So the causes that require both you and your partner are when you may have an expectation, because let's face it, we're amazing people. So women are able to think about a million different things at one time. And so we're often knowing in advance what's going to be going on. We can pack and we can get everything in order, and we could do the grocery shopping, and we can cook, and we could do all these things. And our poor little male counterpart is struggling with just holding one thing in his mind at a time. And this is not his fault. So if your partner has a refusal or simply an inability to match your expectations, maybe because he can't do it, then that really requires you both to make some changes. All right, so let's go into how do you get over, how can you forgive, how can you personally make those changes? It's very, very possible, and it's a lot easier than you think. So women are very colorful. We are amazing and colorful, right? So we are constantly able and trying to come up with creative ways to fix something. But the truth is, we simply have to make a decision. If we've taken through the pathways that it's not something that he can do, if it's something that we know that we have to make this change, then we simply make the decision. We make the decision to change, or we make the decision to forgive and forget, or we make the decision not to. But let's say we make the decision to forgive and forget, or make those changes. Black and white. It's not colorful. It's like taking a dart and shooting it across a wall and hitting the bullseye. If you want to heal, you have to decide it's time. You can't bring it up anymore. You make that commitment and you move forward. And that's up here, and we're absolutely able to do it. So if you're having difficulty, though, seek support and help, because another person's view is always helpful in teasing out the truth and what is really holding you back or holding him back. And it helps us see ourselves more clearly. But once you see clearly what is going on, almost all women can succeed at forgiving once and for all and put it out of their mind. Okay, so let's talk about ourselves, our self-image, our self-criticism. So I put a few questions together for you to think about if maybe this is holding you back a little. Are you concerned with how you look? Who isn't, right? But are you ashamed with how you look? Do you hide your nakedness from your partner, like jumping under the covers before he sees you, or turning off the lights so it's a little bit darker and he doesn't see you naked? Do you wonder if your partner is noticing those extra bulges and rolls, or cellulite, or even lack of muscle, sagging skin? Are you wondering if he's looking at that? Do you feel comfortable walking around naked? And if not, why not? Because this is very much self-image and self-criticism that could be holding you back in the bedroom. So next, I'm going to give you 2 secrets your man truly wishes you knew. about your lovemaking. Number one, he's not looking at your fat, bulges, rolls, or cellulite. He's not looking at it. He's looking at you. He's not looking at that. He loves you first and foremost. You are the most important person to him. Just like you don't notice those things in him. You love him more than anyone else. He's not interested in another woman. You're not interested in another man, period. And those two secrets that your man has, he really wants you to know those. Okay, let's move to environmental causes, because we're going to get into some questions and answers too. And I want to make sure we have some good time for that. So environmental causes, the number one thing you can imagine is stress. So libido for a woman is very much controlled by the accelerator pedal being down and the brake pedal being off. And anything that pushes that accelerator or doesn't push that accelerator or puts that brake down is going to decrease your libido. So stress is a big one, because also everything is, moving around up here in our brains, because we have biologically a lot more connection in our right brain and left brain, the connection called the corpus callosum. We have far more connection between the right and left brain than men. So that's one of the reasons why we're connecting our brains all the time, back and forth. Excess responsibilities, financial worries, family illness or conflict, lack of feeling of purpose or satisfaction in our work or our life, deadlines. These are very stressful things. And I'll have to say, the last couple of years have been more stressful than normal. So this is a big part of our libido. The second thing to think about is perfectionism. Women are often perfectionists. We're pretty good at what we do. So we can get, pretty, we want to keep things pretty good. But that is also involved in decreasing your libido. So I want to give you a little clue about that. What 3 little words that are an absolute must to remove stress from the picture and perfectionism from the picture. And those they're actually 3 little words 3 times, and it's just say no. Just say no. We often don't say no. We often say yes to everything and everybody. So just say no. Stop feeling guilty. So when you do say no, don't feel guilty about it. Move on. Just say no. Stop feeling guilty and give to yourself. Just say no. Stop feeling guilty. Give to yourself. Okay, now, would you like to know the number one reason? The number one reason women fail at achieving their dream love life. I've gone through lots of good stuff, and we're going to get into the physical reasons in just a moment, but I've gone through a lot of good stuff. And the number one reason that women fail at achieving or moving forward with this emotional, psychological, and environmental causes is that they use the word can't. And when can't gets mixed up with won't, then it's hard to grow. It's hard to make a forward movement. So every time you say that I can't, think to yourself, is that true? I can't or I won't. So for instance, let's give it an example. Let's say there's a lot on your plate, a lot going up, and you know that stress plays a big part in your libido. Make a date with your partner. Say, this Sunday, we're going to have Super Sex Sunday, this Sunday. And then all week, be thinking about that. So you won't be saying, I can't do it. I'm going to make a date and I will do it. Okay, so all week long, you're going to be thinking about it. And by the time that time comes, wear something nice that makes you feel pretty, and your libido, you'll see, I promise, will be improved. Let's get into the physical causes because these are very, very important. And it starts with pain. A lot of women have pain as we move through the seasons of our life, pain from dryness or atrophy. And many of us have pelvic floor dysfunction. Can be from a fall. It can be from a surgery. So that pelvic floor dysfunction, something like where we have a lot of muscles in our pelvis, and a muscle spasm or scar tissue, that type of thing can actually be dysfunctional and cause pain with intercourse. Lichen sclerosis is a condition, uterine or bladder prolapse. These can cause pain. And then, of course, there's medical illnesses that can affect your libido, such as arthritis, just pain with arthritis, or depression. Of course, depression will decrease libido. Anxiety will decrease libido. So these are very important to talk about. And then, of course, hormone depletion or imbalance. That's obviously the one that we know so well. So when it comes to debilitating illnesses like arthritis, we need to first treat. That always has to come first. First treat. Never go through pain or suffering. Never allow yourself to go through pain or suffering for the benefit of your partner, ever. But then once treated, adapt with creativity. So positional changes, that scheduled versus unscheduled lovemaking, stepping outside your comfort zone without suffering, like for instance, vibrators or some other sex toy, things that are within your okay realm, but maybe you need to try a few little things that can help with libido. There is obviously lovemaking without even penetration. So that is super important. Know that there are multiple ways to make love, and there should never be pain. So being honest with your partner that you can't have this, but you can have this. And being hopeful and encouraging, I can promise you, your love life will go from nothing to beautiful overnight when your partner finds out that, okay, we can't do that, but we can do this. Oh boy, I'm looking forward to this. I promise you, it's all about what you tell him and share with him. All right. So what about if there's vulvar or vaginal or pelvic pain, specifically like dryness, that pelvic floor, lichen sclerosis, prolapse? I put a couple of things there. This is our happy hoo-hoo. And yes, they're vaginal suppositories to relieve dryness and reverse vaginal atrophy. Also, pelvic floor therapy, extremely helpful. Pelvic floor therapy is a physical therapist. She actually performs physical therapy intravaginally. Yes, it's a new field of physical therapy, but if you have muscles or connective tissue that are contracted, it can be very painful in the vagina, and you can ask your doctor or OB-GYN doctor for a pelvic floor therapy prescription. And this is very, very helpful. I love this book, Pussy Yoga. It's my favorite yoga book specifically for pelvic floor therapy. I recommend it to any patient that I have that has painful intercourse. And it's a wonderful book, just all in all. And it was written by Coco Berlin. She is she's from Germany, and she has also a beautiful website, YouTube site. And she goes through a lot of, she has a lot of free things. I think you'd like it to take a look at her as well. And laser therapy is being used now for rejuvenation of the vagina, for vaginal atrophy, but it's also being used with a tulip procedure for lichen sclerosis, and it is curing lichen sclerosis. And lichen sclerosis is a topic I could talk on all by itself, because it really has a lot of suffering, but tulip procedure can actually heal lichen sclerosis. We use dilators to help stretch the vagina, advancing the size of the dilator as we go. For prolapse, we use pessaries, and of course, surgery. All of those are open to you. Now, how about that hormone imbalance? Because somewhere down the line, as we move through our stages of life, our seasons of life, we do get hormone imbalance. And all hormones, progesterone, estrogen, testosterone, all of these can cause low libido. So low progesterone gives us estrogen dominance, and we can have symptoms that are pretty difficult to think about: sex, anxiety, and moodiness, and insomnia. And a low estrogen, other than hot flashes, we lose our joy, our motivation, our drive, our creativity. And low testosterone, we feel weak, we lose our self-confidence, and we feel tired and fatigued. Now, these are my 10 rules to follow. I would love for you to have a copy of these slides. And these are my 10 rules to follow when you think about hormone replacement. And they're pretty important, but I would like you to get these slides. You're welcome to them. And this is the overview of what we've talked about: emotional, psychological, environmental, and physical. But what I'd like to really do is jump into those questions and answers. So take a screenshot of this, or with your phone, you can write my lovely ladies, Ellen and Millie. They're here to answer questions and connect you with me if you feel the need. And these are their email addresses. And this is another way to connect with me. And you can do open your camera and place it on this right here. It will take you to our website. This is my Women's Midlife Specialist website, which is womensmidlifespecialist.com. Lots of articles and a lot about our hormone products. And we'll be happy to fix you up, and you can connect with me directly as well. And so I think what I'll do is I'll stop screen share now so we can open the floor up to questions. What do you think?
Okay, so let's, what happened?
It's a lot. It's quite a bit.
Okay, so this was terrific. I have a question right off here, and I think this is one a lot of women might ask. She says, my husband and I are in our late 60s. We have a loving marriage and snuggle a lot, but we haven't had sex in years. Is this abnormal?
If you get on the internet, I thank you so much for, what a beautiful question. If you get on the internet, they'll make you think it's abnormal, but it actually isn't. So it's actually a lot more common than you think. Why? Because as we go through the seasons in our life, what becomes important to us, what becomes most significant changes. And so, especially after you've been with someone for a long time. So absolutely not. It's not. And what's important is that you're both in the same place. If one of you had a high drive for actual intercourse and the other one didn't, that's where those love languages and communication and working, making sure that hormones are balanced and so forth, and all the other things we've talked about, that's when it makes a difference. And that's when you want to get it together. But if you're both this way, it's beautiful.
Okay, another question. Can you get pregnant if you haven't had regular periods in over 6 months, but still get them just months in between?
That's a very good question. And we are supposed to tell you, yes, you can. And the reason is because you never know when you're going to ovulate. So here's the thing. Most of the time when that is happening, almost all of the time, that's perimenopause. And most of the time, those are anovulatory cycles, meaning you're not ovulating and you didn't pop out an egg, but you still can. And so, yes, we have to answer that question as a yes, because there have been some beautiful babies born late in life because of exactly that.
Yeah, I could have answered that question. I've got a younger sister. Okay, this one, it says, why do some people say that women are very sexual in their 50s, but others say it fades as you enter your 50s, which is true?
They're both true. That's a really good question because everyone is different, and everyone is different in their 20s too. So, people think that it's just 50s, and then they say, oh, well, women reach their peak or prime when they're 40. That's not, 100% true for everyone. The way a vagina looks in women is just as varied as the way people feel about their sexual drive in every single decade of life. So neither one is true and neither one is false.
I've got another one about going into menopause. She said, my sex life was fine until then, but now, it's gone. So how do I know what's affecting my libido?
Yeah, that's a good question. If it was based on menopause, I can bet my booty that it's on hormones. If everything else is cool in your life and you're managing your stress and all of that, I can bet my booty that it's hormones.
That's the problem. Well, and as a matter of fact, another question says, I've had vaginal dryness and pain with intercourse since menopause. We use lubricants. I've tried vaginal moisturizers, but sex is still uncomfortable. Yet I'm nervous about using estrogen. Should I be?
That's easy for me to answer. No, don't be. You can go to the menopause, the American Menopause Society, the International Menopause Society, the OB-GYN, the OB-GYN. You can go to every one of their websites and you can see that we're using intravaginal estrogen for women of all age of postmenopausal, even if they have breast cancer. So the cool thing about the vagina is that it was never meant to be sterile, right? The penis isn't sterile. I want to put that in there. So the vagina has beautiful tissues that keep things in there. So when we put vaginal estrogen or vaginal testosterone or vaginal DHEA or vaginal pregnenolone, all of those hormones are healthy for the vagina, and the vagina can convert those hormones to what they need. So if you start at the top of what's called the hormone cascade, all hormones come from cholesterol. The vagina has the cells to actually convert that into estrogen, testosterone, DHEA. And that's why now there's a prescription for even a DHEA suppository, because the body converts that to estrogen, which heals the vaginal dryness, the vaginal atrophy. So lubricants are wonderful. I still recommend them. Moisturizers are wonderful. I still recommend them. But healing the actual vagina requires a hormone base. There are laser therapies that have been shown to heal the vagina as well. But no, don't be. We use them. That makes me somewhat sad that it's suffering for women, because this is the information. This is why I love Prime Women, because this is the information that we need to get out to you.
What about testosterone? We hear a lot about that anymore.
I love testosterone. It's so healthy for the vagina. It's so healthy for the vagina and the vulva. And if you get a prescription for testosterone for yourself and you're instructed to apply it, say, to your skin, I always say take a little bit and rub it on your clitoris, because it actually helps waken the clitoris up. So a little bit down there goes a long way, and you give it a month or two and you actually start getting that feeling that you may recall us having back when we were younger. We just see or think about it and we feel that little tingling sensation down there. And that's sort of, the clitoris gets a little, it's our age too. So whatever age we are, it's the same age. So it shrivels up a little bit and it needs a little waking up. So I love testosterone for that reason.
Good to know. Good to know. So with atrophy, should women be looking at getting maybe laser? What would you recommend there?
I recommend laser as the last thing because it is a procedure. There is downtime. It's not without discomfort, but I use it as a last resort. It's not often that women actually need it. That's why a lot of women don't know about it, because if they heal first through vaginal application of hormones, they often don't need it. Now, if it's kind of late in the game, that may take a little too long, or, and this is happening where women went through menopause and they either lost their husband or were divorced. They've got a new relationship. They didn't really think about it for 10 or 15 years. And then they're left with wanting to rejuvenate their vagina. Laser therapy is wonderful for that as well.
And I've got a question about replacement hormone therapy. There's lots of companies out there selling this. Pellets, all sorts of things. What's your thoughts on all this?
Sure. I have a lot of thought on that, obviously. So originally 2012 is when Women's Midlife Specialists came out, and I was doing programs online, just teaching women how to balance their own hormones naturally. Because I was having women come into my practice with hormones that they were getting over the counter. And I was helping them figure out how to use those hormones based on what the ingredients were and so forth. Well, I did this for about a year, and I was getting very unusual results, and I was test results in these women. And I was a little worried. Actually, I didn't know who's making these hormones, and they made me a little bit concerned. So I came out with my own. So ours is called Young Hormones, and we have an entire line. Now, you cannot have testosterone over the counter because that is a controlled substance. But estradiol and estriol and progesterone and DHEA and pregnenolone, those are all available over the counter. So I put my own line out, and I know what's in it. Every ingredient is a stage 1 or 2 in the Environmental Working Group's Skin Deep database. So they're all 100% natural, healthy, no level 3s, 4s, or 5s in our creams. So we have the healthiest, most beautiful cream, I think, out there. They're called Young Hormones. They look like this. Like, for instance, this is our Heaven cream, and it's a bioidentical 80-20 mix, 80% E3 with estriol with 20%. We have Princess, which is our first one that I usually recommend for women who are starting menopause or perimenopause, and that's a 50-50. So I have lots of education on this on our website, and we have a newsletter we put out twice a week that educates women.
I just want to thank you so very much. I know everyone absolutely loved this, and we're so thrilled you're going to provide the slides, and they'll be hearing lots more about your products as well. So thank you for joining us, everyone out there, and we look forward to seeing you again on our next webinar. Thank you so much for being here.
Thank you.